Most women in the United States give birth in a hospital, and today we are talking all about the pros and cons of hospitals versus birth centers versus home births, all of the most common options, and why some women might consider giving birth outside of the hospital. So if you are trying to make that decision, or actually if you're even sat in the hospital but you want to just be more educated about different options, then this video is for you. Hi, I'm Rachel Moises from the Mighty Mama Movement.
And I'm Heather Shelley, family nurse practitioner and midwife.
Okay, so we are not anti-hospital. Just want to be clear about that. We are into natural birth and unmedicated birth and all of those things, but I've given birth in a hospital setting, so has Heather, right? And we're not here to convince you of where you should give birth, but as in all of our videos and our education, we want to help mamas be informed so that they can make the choice that's best for them, whether that is the hospital birth or home birth or the sort of middle ground of a birth center, which really can vary from place to place what that even means. So let's, I guess, start out by just talking about the standard hospital birth. The majority of women in the United States do give birth in a hospital. Is that right?
Right.
And what would you say are the reasons why that's the case?
Typically, it's our culture. We give birth in the hospital here. It's just what you do. It's what you're doing to, I guess you could say, the normal that you would do. And some women, that's all they know. That may be all they have available in their area where they are. And so it's just, oh, I'm pregnant, I go to a doctor, I have my baby in the hospital.
It's sort of standard procedure. So if you're considering an out-of-hospital birth, you're going against the norm. Right. Okay, I'll be honest. I think a lot of people consider, especially home births, flat out weird or like really hippie, or just, I think that still is the perception that a lot of people have. Do you think?
Oh yeah.
Yeah.
Definitely. Okay. Yeah.
So
I was going to say, with hospitals, one thing, let me kind of define, if that's okay.
Okay.
Because many hospitals will call their labor and delivery units birth centers. They're not. When we talk about a birth center, we're talking about an independent, not connected to a hospital birth center. So we're going over hospital births, anything that happens in the hospital with birth. We're going over a freestanding birth center, not associated with a hospital at all. And then, of course, your home, whether it's your home, an Airbnb, your mom's home, whatever, but just a home birth.
Okay. Okay. So can you explain what is that, the birth center?
Okay.
The one that's not in a hospital, but.
Right. So most birth centers in the United States are owned and run by midwives. Some are certified nurse midwives, some are licensed midwives, and they aren't connected to hospitals. There are, I don't know how many, but less than 100 birth centers in the country that are attached to a hospital. So they have a labor and delivery unit and they have a hospital. And they have a birth center, sorry. And you can't have an epidural or anything in the birth center. If you do, then they transfer you to the labor and delivery unit. And those ones are pretty rare. There's not many of those. And that's why we're not talking about them a lot today, because they're still bound to the constraints of hospital rules and regulations as well. And then not every state has birth centers. So Florida has the most in the country. They have, I believe, over 50 birth centers. There are a lot of birth centers there. And some states regulate them, some states don't regulate them. Some states you can have one birth room, some you can have up to 5 birth rooms, and then some you can't do a birth center at all.
Oh, okay. That's a bummer.
Yeah.
So Heather has a birth center.
Right.
I gave birth for my last 5 births. I have 8 babies, if you don't know. And my last 5 births were in her birth center. So a birth center is like an in-between. It's not a hospital. It's not a home birth. But usually the setting is a bit more homey. Like in Heather's birth center, she has her different rooms. They're more like a hotel room. No, more like an Airbnb room or something. Oh, was it?
Yeah, actually was an hotel.
I don't even know say hotel room, because hotel rooms are kind of sterile, and it's sterile as in clean, but like it's not comfortable and homey usually in a hotel. More like a bedroom. Why am I saying hotel room? It's more like a bedroom.
Right, exactly.
With like a bed with, cushions and all of that. So it doesn't have that like cold, harsh feeling of a hospital room.
And it's going to depend really on the personality and the rules and regulations of the midwife in the state. I did a couple meet and greets yesterday. We do like a free meet and greet at our birth center where you take a tour and you can ask questions.
Yeah.
And one of the moms said, I like your place. It feels more like home. And I said, well, what do the other ones feel like, the competitors? And she said they feel more like a sterile environment. Okay. And she liked it, where some people want more of that sterile feel. Right. And for me, I'm like, if you want that feel, go to a hospital. I want my mom's, it's clean and it's sanitized and everything. It's
sterile as in cleanliness is concerned, right? But just the decor and everything.
Right, exactly. We have the nice decor and we have the candles and the crystals.
Better lighting.
Yeah, exactly. Mm-hmm. Yeah. So.
And also, okay, so it sounds like we're trying to convince you on the birth center. Maybe we are.
But it's really informing people.
Yeah, just wanting you to know, like, it's intentionally, usually, because apparently it depends where you go, but a lot of birth centers intentionally are trying to give you that feel of I'm relaxed and I'm at home and I'm comfortable. Hospitals don't try for that at all. They don't care at all about that. And maybe you don't either, but the hospitals don't. And then if you take it one step further for home birth, some women really like that because it is home and they completely feel relaxed and comfortable there. And that can really help labor be less stressful and help them get in zone and be more relaxed, depending on your personality. Of course, some people can't relax as much in their home. Like for me personally, I never considered a birth at home because I was worried about keeping everything being clean enough. I had older kids that I would have to deal with, and I didn't want to. And I liked the idea of leaving and just whatever was going on at home, I didn't have to worry about that as I'm in labor and like, oh, hurry up and get the dishes out of the sink and someone made a mess in the bathroom and kids leave me alone, or I just didn't have to worry about that. It's just whatever was going on at home when I went into labor. I ended up being induced for like all my births, but I worried that could be a situation I wasn't going to have to worry about it, and I could just go. But a lot of women's personalities, they don't have that conflict. They're like, oh, I want to be at home, and I don't mind if whatever's going on around me, it doesn't bother me.
So my first two were in the hospital. The first one, that's just how I thought you did it. And that, like you said, people that did home births were rogue or something. And there were no birth centers at the time in Utah when I gave birth. So that was not an option for me. My second baby was a hospital just because of preterm labor threatening. So I kind of wanted that security with the doctor with the preterm labor. And then my third baby was a birth center. We had one bathroom in our house. And I was like, nope, I'm not giving birth with one bathroom, because what if I'm in the bathroom and then everyone else has to pee? And I knew I'd be thinking the whole time. And it was the same thing. I didn't want to worry about the dishes in the sink. I didn't have a fancy tub. The birth center had a fancy tub. It had like 6 bathrooms. And I knew I could just kind of, and it was pretty. To me, it was very pretty. And I wanted that relaxed, pretty feeling, if that makes sense.
Yeah, it does.
On top of it, because there were no children running through the house coloring on the walls with crayons. So that kind of thing.
Right.
And then my fourth baby, we had moved 45 minutes without rush hour traffic from the birth center. And I was like, there's no way I'm driving in the car for 45 plus minutes to get to the birth center. I was like, not happening. So I did a home birth with my last one because of distance. And I had 2 bathrooms by that point. So I could relax a little more. Yeah.
So what is the difference as far as the medical option safety between hospital, birth center, and home birth?
So a lot of people think that we don't have a lot of things that the hospital does. And we do. No, granted, that depends on the rules and regulations of your state and of your provider. So a licensed midwife in Utah can carry a lot more medications than a licensed midwife in Arizona, for instance. So you have to look at licensure of your provider and all of that. But we have oxygen. Ours are in tanks rather than a plug in the wall. We have the same 3 hemorrhage medications that any hospital has. In fact, we have 4 hemorrhage medications that we can use. We can do IVs. Not everybody can do IVs. Not everybody can carry all those hemorrhage medications. So once again, you have to look at that part of the picture.
Mhm.
There's not a rule across the board.
Right.
Where hospitals, it pretty much is a rule. We have, we sterilize our instruments in an autoclave. We have all those
What
things.
about like if the baby comes out and needs to be resuscitated or something like that?
So we have the oxygen, we have ambu bags, we are all certified in neonatal resuscitation, the same certification that all the nurses in the hospital have. I like to tell people the difference is we are the button on the wall. Where in the hospital, if a baby comes out and needs resuscitated, they hit a button and the respiratory therapy team comes in. We are the respiratory therapy team. We do it all. So you kind of get it all bundled in together.
Okay.
Yeah.
And how about at a home birth?
At a home birth, it's pretty much the same. Where it differs is I only bring 2 or 3 bags of IV fluids. And so if I can't imagine you needing more than 3, but let's say something happened to one of the IV bags. At the birth center, I have a case of them, where at a home birth, I'm limited to the 2 or 3 that I brought. If I drop an instrument on the floor at a home birth, I probably don't have a whole lot of extras, where at the birth center, I've got a closet full of sterilized instruments. I can also just kind of control things a little bit better. So like I have a rule with home births that you can't have your birth tub shoved between the wall and your bed and a dresser. Because, does that make sense?
Yeah.
I'm like, we're not doing this. I'm not jumping over your bed to get to the other side of the birth tub because you're having a shoulder dystocia.
Right.
So in the birth center, it's a more controlled environment where I have the tub where I can access 3 sides of the tub. There's no bed that I have to shove out of the way. It's a large room. And so I have things set up for safety that way. Where at a home birth, I'm kind of a little bit at the mercy of the parents that way of, okay, how big is this room that you want to give birth in? Or going in and saying, I'm sorry, this is not a safe environment. We need to give birth somewhere else. Whether it means the bedroom is too small for what you desire, we need to give birth in the living room, or there are a lot of animals here. We can't have animals roaming around the house on all the birth equipment while you're laboring, that sort of thing. So it is a more controlled environment that way.
Okay, but you're still bringing all of your tools and interventions, whatever you're ready for most things.
Right. And in fact, I give moms most of the equipment that I will need at her 36-week visit to take home. And I say, put this in the corner. Please don't let your animals on it. Please don't let your kids get into this birth kit. I give them this big duffel bag of equipment. And then I bring a smaller bag with me and some other items like the oxygen tank. That way, if mom is progressing quickly in labor, I'm not having to go out to the car 4 times. Everything is there. So I just bring in my bag and the oxygen tank, and everything else is there ready for me. And I can pull it out in the middle of the room, unzip it, and unpack it. But that's one thing too, is that I have to unpack everything from this bag. And that does take a bit of time, where at the birth center, I have everything pre-prepped and laid out.
Right. Okay.
So
would you say that for moms considering a home birth or a birth center or a hospital birth, how big of a concern how much should they be concerned about, like the safety? Like, oh no, it's just so much safer to be in the hospital.
Really, a part of it depends on, a real big part of it is the care provider. If the care provider can carry 3 different types of hemorrhage medications like the hospital, there's no difference. If they can do an IV like the hospital, there's no difference. If they can do a lot of those things, there's no difference. So for instance, at our birth center, we have a doctor on staff. And so the only thing that we can't do is premature babies, because we don't have a NICU. If we do have a baby that needs more than basic resuscitation, but they need a NICU, we would have to transport for the NICU. We don't do blood transfusions. which I've never had anyone need. So let's not go there. Okay.
Okay.
All right.
We won't.
We don't do epidurals, but we do have laughing gas, and we do sterile water injections and stuff like that. And let's see, and we don't do really high risk, like preeclamptic women, women with cholestasis. But our birth center, because of our providers, we can do twins and breeches because we have specialized training in that. And so that, once again, you have to look at the rules and regs and everything. Now, what are the disadvantages of a hospital? You know, we've talked about some of them in other videos, why women choose an out of hospital birth compared to a hospital birth. And the number one thing is that freedom of movement, freedom of choice that is much more limited in the hospital. And that can be a risk factor in and of itself.
Okay, Mom, a quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dilating to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learn these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you'll be so glad you did. Okay, so what she's referring to here is that hospitals have policies, doctors have policies, and a lot of times you can't be an exception. Like, they won't make an exception for you. You have to follow the policies. That's the way that we do it here. And so actually with my last birth, I was getting some pressure to do a hospital birth because I was having some extra monitoring in the hospital. And you know, the doctor there was trying to pressure me to do it, but I felt confident. Heather's my midwife, so I felt confident in her ability to handle any potential risks. And because they weren't like high risks, they weren't anything that like, oh, you do have to give birth in a hospital. And my birth, I knew in the birth center, because of my freedom of choice and being able to implement all the things that I've learned and that I know work better in birth, that I would actually have lower risk and I'd have a faster, smoother delivery, which in and of itself lowers a lot of the risks that you could face. And I did have a successful, wonderful birth. And that was, I really think, went much better for me than it would have been in the hospital, barring, like you said, certain high risk mothers really won't have the option of an out of hospital birth. But
so some of the complications that people are afraid of that think can be handled better in the hospital, and once again, that depends on the skill of your care provider. Okay, because hospitals aren't perfect. Trust me, I've worked in hospitals. Just because you're in a hospital does not mean you're going to get the highest level of care. Let's make that very clear. Okay, it's all dependent on the provider. So hemorrhaging is one. If your provider has the medications to handle hemorrhaging, then okay, that's a problem solved. Resuscitation. Do they have an ambu bag? Do they have the oxygen? Do they have the things that are needed for resuscitation? If the answer is yes, okay, well, that problem solved. How far are you from a hospital? Are you 5, 10, 15 minutes, or are you 1 or 2 or 3 hours? So that can make a difference. C-sections. A lot of people think, well, what if I need a C-section? Unless you are in a major teaching hospital or a major metropolitan hospital, which are typically teaching hospitals, there is not anesthesia on call in the hospital 24/7. There is not a doctor 24/7 in call. Doctors have to be within 15 to 20 minutes of the hospital when they are on call. Anesthesiologists have to be within 15 to 20 minutes. And so if we have a mom that's not a, hey, I think you need a C-section, but a true emergency, which are so rare. This is a little side point. I hate it when people say, I had an emergency C-section. Were they running down the hall and slapping anesthesia on your face? If the answer was no, it was not an emergency. It was an unscheduled C-section.
Okay.
I have seen 2 true emergency C-sections in over 1,000 births. They are very, very rare that it's a true emergency.
Right.
And so by the time that we call the ambulance or call the hospital and get in the car, the staff in the hospital is ready for us, because it's going to take them 20 to 30 minutes to get anesthesia in there, to get your surgery nurses prepped, to get 2 doctors, because you need to have a doctor and a midwife that is certified as a second assist, or 2 doctors to do a C-section. You can't have 1. And we can get that ball rolling from home or
while
from
you're
the birth center.
transporting.
Exactly. So that the hospital can get that going. So like I said, unless you're giving birth in a major teaching hospital, you can't get a C-section within 10 minutes.
Okay. So you're saying if you have to transport maybe 20 to 30 minutes to the hospital, it's not going to actually slow down when your C-section starts. Like, you can still start at the same time if you had been in the hospital.
Right.
But that, of course, like you said, if you're doing an out of hospital birth far away from a hospital, that's a little bit of a different story, even though like these emergencies don't happen that often.
Right.
But if it did, then you would be dealing with this. We're far away from a hospital and now suddenly we need one, right?
Right. And that's pretty rare though. It's very, very rare. So,
it depends where you live, because where we live, there's like hospitors all over the place. It's like, that's nobody lives that far from a hospital where we're at. But it depends where you live. Maybe if you're very rural,
right,
then that's something to consider. But then that's a whole other flip of the coin. If you're very rural, you're far away from a hospital, which means if you're going in for a normal non-emergency birth, then you've got the risk of never making it to the hospital.
Exactly.
Which is the more common scenario, that you're not having an emergency, you're just having a normal birth, right?
And so you have to look at that big picture, because it's typically not black and white. Like I said, I have people say, well, what if I need a C-section? What if I need this? Well, what if I need that? Well, we can still get you those things. It just varies on how, what's happening with that. So,
okay. So I think a lot of what I'm hearing is it depends on your provider. You want to make sure if you're doing an out of hospital birth, you feel comfortable with the skills, experience, and just resources available to your provider.
Right.
And how far away you are going to be from hospital is a factor to take into consideration. I don't expect you to know the exact percentage, but like, how often does an out of hospital birth need to transfer to the hospital? I'm not.
Right. So once again, that depends on the rules and regs of your midwife, because typically only midwives do out of hospital births. There are only about 10 doctors in the country that do out of hospital births.
Okay.
And we happen to have 2 of them in Utah.
Oh, okay.
So, and one of those doctors actually doesn't do a whole lot of births anymore. So he just does lecturing. But anyway, it depends on your care provider and what they can do, not just from the rules and regs, but from their experience levels. So a newer midwife is going to transport typically a lot more often than a midwife who's done it for 20 years. And so looking at those reasons.
Okay.
Yeah, so what is that number? I've seen it as low as 5% and as high as 30%.
Okay.
So the newer midwives are typically going to have the higher ones. And that's something to look for, is what is the transport rate? Because you don't want too low of a transport rate, because you're like, well, are you not transferring people you should be transferring? But a high transport rate is somebody that is either ill-experienced, which just give them time and they'll do better, or it's somebody that just doesn't want to handle things. And do I really want somebody who won't handle things?
Right.
So.
Yeah. Okay. Well, I want to share an experience actually about handling things. With my 7th baby, I had a great labor. Everything went lovely. His head came out super easy, but then nothing else came out. That's not how it's supposed to be. Once you get the head out, it's like easy, smooth sailing from there. The rest is kind of goes right out. It's nice and easy, but his shoulder got stuck. And so I didn't really know what was going on. I've never had experienced that before, but of course Heather recognized what was going on, and they did what they had to do, put me in a pretty uncomfortable position to be able to get the shoulder unstuck, the position that makes your pelvis open like the widest that it physiologically can open. And she was able to get the baby unstuck. And honestly, it was pretty, I'd say, an unpleasant little few seconds of my birth, but otherwise everything went great. But afterwards, she just kind of said, I want to explain what happened, because I think you probably didn't even realize what was going on. And she, explained to me all of this. And I asked her, what would they have done if I'd been in the hospital? And she said, well, there's a few things they would do, but most likely when you have shoulder dystocia, you're going to go for a C-section. Am I remembering right?
No, that's okay.
Explain what happens if you're in the hospital and they deal with that.
In the hospital, you're typically giving birth on the back.
Yeah.
And the only way doctors are taught to do it is they have your knees to your ears, like really hardcore, your knees to the ears. So it's called McRoberts.
Okay.
And then a nurse will, with her fist, push right above your pubic bone and try to dislodge baby's shoulder.
Oh, okay.
And then they just kind of pull on the head, which is quite dangerous. And the only maneuver or procedure or whatever you want to call it in childbirth that is named after a woman, don't even get me started on that, okay? The only one named after a woman is called the Gaskin maneuver. And what that is when we have a shoulder dystocia, we flip mom to hands and knees if she's on the birth stool or in any other position. We flip her to hands and knees. And what that does is that helps open up the pelvis, and we're able to go in and rotate the shoulder. And then the other version of it, which doesn't have a name that I know of, like if you're in the tub, I have you stand up and put your foot on one foot, typically the right foot, on the side of the tub. And that opens up the pelvis that way. And then I can go in and rotate the shoulders and help baby come out, which is a lot less traumatic to mom. You may think standing up, but remember, moms don't have an epidural. And flipping in hands and knees is a whole lot better than having your knees shoved behind your ears. You can't take a deep breath, and a nurse shoving her fist right above your pubic bone.
So that was basically my point, that I remember thinking, oh, I'm glad I had that complication here in the birth center and that I didn't have to deal with it in the hospital, because it still wasn't the most pleasant thing I've ever done.
No,
but I think it sounded a lot better.
Definitely. Now, if women continue to have shoulder dystocias, a lot of times the doctors will say, oh, you had a shoulder dystocia, let's just do a C-section this time. Or they'll say, your baby is big, we don't want to risk a shoulder dystocia, let's do a C-section. And I have never seen doctors panic more than with shoulder dystocias in the hospital.
Oh, really?
And that's because their moms can't move. They typically have epidurals. They are not taught the Gaskin maneuver. And so all they know is, I have to figure out how to unhook this baby without mom helping. Where out of hospital or with midwives, we're taught the Gaskin maneuver. We're taught the standing lunge. Our moms can move and they can do it. And oddly enough, I handle a lot of shoulder dystocias here. I don't know what it is about here, but a lot of them. So I've done enough of them that they don't bother me. Yeah.
So point being, there are some things, and we mentioned this before, that will just sometimes go smoother and better. And so you can actually avoid some problems in a hospital. And then the whole other thing is, in the hospital, if you've got your epidural, you've got Pitocin and some interventions, they do increase certain risks. Like you're saying, we always think of I don't always, but I think most women think of the hospital as safer.
Right.
But because some of the interventions, and this is statistically speaking, increase risks, I don't know if you can really call that 100% safer.
Right.
When you have an increased risk of complications and a much higher rate of complications because of the way they handle birth, I'm not sure. That doesn't necessarily sound safer to me.
Well, I will get women that will say, oh, like they'll find out I'm a midwife, and they'll say, oh, if I'd have had my baby at home or outside the hospital, my baby would have died. And I'm like, or I would have died. And I say, okay, tell me your story. Tell me what happened. And most of the time they wouldn't have died. They'd have been just fine. They hemorrhaged. We'd have used the same medications that the hospital used to stop the hemorrhage. We'd have done the same IV that the hospital used. We'd have done those same things. And sometimes it's because the hospital caused the problem. You know, they were like, well, my baby had fetal distress, and so we had to go for an emergency C-section. And I'm like, okay, first off, it wasn't an emergency, okay? And second, if you hadn't been on Pitocin and induced and had all of these interventions, your baby most likely wouldn't have been stressed out. And so a lot of the problems hospitals cause.
Yep.
So,
and that's just the truth. Sorry, I know a lot of women don't want to hear it,
but it's true.
But it is true. Obviously, we embrace natural birth here at the Mighty Mom Movement. That's kind of like our thing. No judgment for women who don't want a natural birth, but we firmly believe that a natural birth is a smoother, easier, less painful and less complicated birth over one with medical interventions and other problems. Now, you can have a natural birth in a hospital.
Definitely.
It's just that we've been saying, you might have to kind of fight for that a little bit and run butting heads against hospital policies and doctors' policies and things like that. But we do talk about that in a lot of our content of how to navigate that if that's what you're wanting in a hospital birth. But the truth is, a lot of women, that's why they choose an out-of-hospital birth, because they're like, well, I don't want to be fighting for what I want. And I don't want to be fighting for what I've learned is better in labor. And for some reason, the hospitals are not supporting that, even though it's, you know, evidence-based information that it is better and smoother and easier for labor. So not trying to convince you one way or the other, but these are just some things to take into consideration. Okay, anything else we need to talk about? Home births, birth center births, or hospital births?
I think the things, once again, to kind of recap, are location from emergency services, the qualifications of your care provider, the limitations or the scope of their license, and what is available to you in your area. In a lot of states, you are going to pay out of pocket for a birth center or a home birth. There are a handful of states like Florida, Washington, Oregon, where insurance is mandated to cover them. But then many states, insurance is not mandated, so it'll be out of pocket, out of network.
Okay.
Yeah. But for somebody who's not insured, that can actually be cheaper.
Yeah.
So.
Okay, well, we hope that helps you. And don't forget that if you are planning an upcoming birth, we have our free online birth class, How to Give Birth with Practically No Pain. This is a natural approach to have unmedicated birth, but it can help women who are planning for a medicated birth as well, because it's all about how your body works and how to have the healthiest pregnancy and the healthiest, best, easiest birth possible. So there's a link for that. Be sure to check it out. It's completely free. And we will see you in our next video.